I was prescribed like 10 Ativan a day as needed. That's a huge amount of, that's a dangerous amount of benzodiazepines. I mean, it was, when I began heavier medications like lithium, for example, I was on that for months before realizing that you're supposed to have blood work done. You're supposed to be monitored on it. None of this was brought up to me. I wasn't aware of any of this, and I trusted the doctors, right? Because I felt like I was out of control, and this is what we're told to do. Bring yourself to go get help. And the doctors told me, you know, you need these medications. And I was at a point where I was willing to try anything. But again, realizing now how dangerously I was prescribed. And again, this is my experience. I happen to have some very irresponsible doctors, and I have experienced true malpractice, which is different than medical negligence. You know, that really is on the doctor. And my path just happened to lead me to multiple doctors that took that route. So regardless, I found myself actually in psychosis at this point. I mean, I'm living a nightmare now. So I've quit my job. I'm skipping over what I like to call a lot of big T and little t traumas that were happening simultaneously. But just speaking to the medical side of it, I, you know, rapidly became the most treatment resistant patient that they'd ever seen. And this is why they were prescribing me just exorbitant amounts of medications and cocktails that, again, were truly dangerous. And because this was an improper diagnosis, because this was not solving any of the root causes, I did not have a positive reaction. My reaction was psychosis. So I became this self-fulfilling prophecy, right? What began as PTSD and trauma was misdiagnosed as mental illness, which led to the pharmaceuticals. Now I am actually in psychosis. And this is where, you know, my medical history gets really muddy and complicated, not only on a personal level, because I was essentially not cognizant for the majority of this experience, but again, you know, the circumstantial trauma that was happening at the same time as my body just being pumped full of all of these toxins resulted in a lot of epigenetic changes and diseases that, again, you know, our current medical system, for example, I'll take diabetes. Even in a hospital setting, if you don't have diabetes genetically, if you're not predisposition, they wouldn't even take my blood sugar when I would come and say, you know, I'm experiencing extreme thirst. I can't see, like symptoms that you would think were impossible to deny. I can't use my legs. I'm turning blue from the waist down, you know, these things. And because of my medical chart, right? Because I had this mental illness, a doctor would literally not even take out a stethoscope. So this just compounded my trauma of, you know, it's seemingly the definition of insanity, right? Bringing myself continuously back to our system, because what else was I going to do? Just rapidly deteriorating, sicker and sicker, and consistently met with, it is in your head. I mean, that's a very scary and real situation, because I was absolutely, you know, dying. Ultimately, I was undiagnosed diabetic for so long that we realized my blood sugar, which is, you know, a normal level, 80 to 100. I had been living at like 800 to perhaps over 1,000 for months before, you know, and again, this is what I have continuously found about our system as well. Our current medical system is only set up to be able to respond in that emergency situation, right? So we need to let your symptoms progress to the point where it's catastrophic, and then we can take action. Then we're going to be able to do something about it. And I'm grateful, right? Because to that effect, Western medicine saved my life. Absolutely. when I was finally diagnosed.